What's going on, everyone? Happy Thursday. Hopefully everyone is doing well, staying safe, healthy, having a great day so far, and testing negative for the viruses. It is time now for the Thursday edition of the Virus Update for Thursday, August 7th, 2025. If you are new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Hey, COVID's still out there, and we're in the middle of a summer surge here in the United States and some other countries. Over in Australia, it's wintertime, which means they're dealing with a big surge in flu. You need to be informed about all this. That's what I do here on my channel each and every day. Want to stay informed? Just subscribe if you're new down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. Leave your comments down below and consider becoming a member of the channel. Details for that are listed on the channel's page. Alright, starting off with some news stories today. Then we're going to take a look at some daily data and some weekly data. We do have some numbers from ZJS today. Actually, quite a few numbers from him today, which it's good to see, but wait till you see the numbers. They're starting to get a little bit higher, which is not good here in the United States. Starting off with New South Wales. Two things for there. First off, flu cases have almost doubled in July. This is according to Dennis, the COVID info guy. He shares a lot of information on Australia and sometimes New Zealand as well. The latest data shows a jump of more than 78% in the number of flu cases in July. 37,895 compared to June, which had 21,257. One can only hope August starts to come down. And let's see, is August starting to come down? Well, yes. Here we go. The New South Wales Respiratory Surveillance Report, week ending August 2nd, 2025. So some of that could still include July numbers, but the COVID positivity rate is 5.1%. Number of laboratories reporting COVID, 2 out of 4. COVID cases, 1,961, down by 12.1%. Influenza, 8,206 cases, down by 2.5%. RSV, 1,626 cases, down by 6.4%. Now, as those of you who have been on the channel for a while know, I like to follow climate and weather. I do know parts of Australia, I don't know about New South Wales, parts of Australia have been really cold for winter, even for their standards at this time of year. That may be keeping more people inside. That may make some portions of Australia, maybe not so much New South Wales, but somewhere in Australia could see a surge or a resurgence of the viruses because of that. Hey, we saw it happen here in the United States last year. Or just this past winter. What am I saying last year? It was the start of 2025. February had a big resurgence and double peaking here in the United States because it got really cold for many people, and it just, people moving about, it just caused the viruses to go up again, or was one of the reasons. New South Wales COVID-19 for the sequencing, NP.1.8.1 is now at 72%, XFG is at 15%, KP.3 is 7%, JN.1 is at 4%, and LP.8.1 is at 2% of the cases. And all regions are trending lower for COVID at this point for New South Wales. Alrighty, while we're on the subject of COVID, I thought, well, let's just put the UK next. And here's the weekly update for the UK. The cases are down slightly, but I do have a concern. Your positivity rate is going up. First off, the cases, 1,046, that's down by 28. Deaths, 43. Hey, that's actually down by 16. That's good. Healthcare, we disregard that number again because that 737, that's the same number it's been showing for weeks. Yes, they show these decreasing here in hospitalizations, but again, this number up here is still the same number. It's down from whatever the number was last week because it's been saying 737 for many weeks. Now we come down to this, which is problematic. You notice the positivity rate at the end of July was like 5.9%. Now it's gone all the way up to 7.26%. Pretty big jump in the past week. In fact, it's jumped back to the highest level since middle of June. A little concerning there, but the cases have not shown up for that. That's telling me not enough people are getting tested. Some people are just not testing at all, and then these at-home tests. So, yes, the positivity rate has gone up there once again. All right, take a look at this. Study, risk of RSV not heightened in kids with recent COVID infections. This is interesting. We're just going to read like the first We'll just read like the first paragraph of this. I think I may do a short post today on my site with today's news stories. You'll be able to read the rest of this there because we have a lot of other things to look at. Pediatric hospitals across the United States saw a surge in respiratory, the RSV, in the summer of 2021 and in the fall and winter of 2022, which many clinicians consider to be a rebound from lifting 2 years of pandemic restrictions and possibly a suppression of immune responses following SARS-CoV-2 infections. Now, a new study published yesterday in Pediatrics used data from 27 U.S. health systems to analyze how and if children under the age of 5 were susceptible to RSV within 15 to 180 days of a COVID-19 illness. So, it sounds like here, if we kept reading on, it sounds like here there is no significant increase in the number of kids who are getting RSV after a COVID infection, which is some good news. Again, if you want to read this full thing, we are going to post this. Matter of fact, I am going to post this in the studies section on my website. Also, take a look at this. U.S. measles cases and outbreaks continue steady rise. There was an update on the measles situation here in the United States. In a weekly update today, the U.S. Centers for Disease Control and Prevention, CDC, reported 23 more measles cases, bringing the national total for the year to 1,356 cases, the most since the United States achieved measles elimination in 2000. So, yes, measles are still going up. Here is the CDC measles page. Let's refresh this, shall we? Saying as of August 5th, a total of 1,356 confirmed measles cases were reported. It does now say 41 jurisdictions. Again, I don't know if we'll hit all 50 states, but we're sure getting close to it, aren't we? And real quick note, that study before, I'm also going to leave that in the comment section down below because I do realize, yeah, we probably should have sat here and read the whole thing, but there's not enough time in these videos for that. A summary on the Legionnaire's disease outbreak in New York City. This is Steve posted this on my website, datareport.info, and here's the update. The outbreak has grown even bigger. It now stands at 3 dead and at least 64 people sick in New York City. So this is not good. This is something that really needs to be taken care of. It looks like this is happening in the central Harlem section of New York City. Again, New York City is a very populated city. I've been saying this for many days, and this is not a good thing to see. All right, something else that's not good to see. The World Swim... wait a second here. Where's it at here? Here we go. The Worldwide Championships for Swimming. Not the Olympics, but the championships. You know, even when the Olympics don't happen, there's still events that go on each year. And you know what? This event was a super spreader for illness. It happened in Singapore, and a ton of people got sick. They're talking about GI issues, with food illness issues. But there's something else that was there as well. You know, something that we use these guys for. Yes, COVID. COVID was present at these Worldwide Swimming Championship, and several names are mentioned for COVID, and then there's several names mentioned for other different things. I mean, look at all these different names that were included in this article. You can see here, people from all around the world attended here, and people from all around the world got sick from this event, and eventually I will get around to adding the COVID names that are listed here to my COVID positive archive. It may take me some time before we get to that because I haven't actually had a day where I spent working on that in ages. All right, moving on. We have a lot more things. Taking a look at this, the wastewater viral activity level for COVID in Canada is now up to moderate. Flu A is low, Flu B is low, and RSV is low at this time. Taking a look now at what's going on with heat-related illnesses, pretty much no region of the United States is spared. It's hitting everywhere. Some areas worse than others. Northeast has been pretty bad. The Southwest has been bad. The central states have been bad. Northern Plains, I would say, while they are definitely having some counties with heat-related illnesses, not as bad there, so that's good. Pacific Northwest, yeah, Oregon, Southern Washington, you're having problems as well. All right, let's take a look at what's going on with air qualities which are still bad. Canada's still doing bad. And take a look here in the Northeast. Yeah, the wildfire smoke was supposed to get better today. It got a little better, but when you look in the sky here in the Northeast, it's still hazy. It's still there. One of the models that I have showed on here before, the wrap smoke model, does show this actually pushing back to the west a little bit tomorrow and then dissipating some. But look up here in Canada. It's building. At some point, we're going to tap into a northwest wind again, and it's going to come back down. So I don't think this is going to be our last round of wildfire smoke. We're also seeing wildfire smoke from wildfires in the west as well. Though be it not as bad, it is present there too. Taking a look at what's going on in Florida. And in Florida, we do have some calls going on in Pinellas County at this time. Philadelphia EMS calls yesterday, 778, slightly higher than the day before, which was listed at 739. Live looking at Montgomery County, Pennsylvania, shows, let's refresh this to make sure it's up to date, 16 EMS calls at this time. Alter mental status, that's showing up a few times. Respiratory emergency, just one of them right now. Live looking at what's going on in Chester County, Pennsylvania, shows several calls at this time. That's busy for Chester County. Taking a look at Bucks County, Pennsylvania, for EMS call activity, we see, well, before I refresh this, it was at 6. Now it is up to 10 calls, and we do see back pain, just several different things showing up here. So, yeah, not good to see that EMS is on the busier side today, but here is a little bit of good news. The hospital situation in Pennsylvania, look at all this green. Not doing too bad. I would say we're doing better right now during this COVID surge than we were during the one back in the wintertime. Why would that be? Well, back during the winter months, we've had COVID, we had flu, RSV, and, well, whatever, pneumonia, whatever else was going around the wintertime. And that really put pressure on the hospitals in Pennsylvania. We're doing better right now, but remember, this wave's not over. It's still growing in Pennsylvania, so things could change in the coming weeks. In New Jersey, psychiatric issue at University Hospital. And let's see, I believe there's one other issue. Specialty issue at Hoboken University Medical Center. Looks like the CAT scan is down. And a stroke and trauma diverts at this time. Yikes, that's never a good thing. All right, New York State today with the update that includes New York City. 718 new cases. That is the highest number of new cases since, we got to go back pretty far. We got to go all the way back to on or about the beginning of May is the last time they had that many cases. The hospital situation, a little better today. 341 people in the hospital, 34 in the ICU. That is a drop for the number of hospitalizations. A slight increase by 2 for the number of people in the ICU. Taking a look at Ohio today. And in Ohio, we do see RSV. There are 5 people hospitalized. Flu, which is up a little bit. Flu, 14 people hospitalized, down slightly. And COVID-19 is now at 94. They're about to pass 100 pretty soon. The previous week was 89 people in the hospital there. Alrighty, I do want to show you, let's just say we do, how about 2 wastewater sites today, shall we? Let's go down to Kinston, North Carolina. I'm seeing COVID listed high. What's going on there? Yeah, overall, you have been rising since on or about June 25th. Median for norovirus, that actually came up a little bit this summer, so that's not good to see. Now let's go somewhere out on the West Coast. How about we come down to Los Angeles? 2 wastewater sites there that are grayed out. That's not good. Los Angeles, this particular wastewater site is still low. We'll get the full picture from LA's website. That should either update today or tomorrow. We'll probably get to that over the weekend. And we do see here hepatitis A. There have been some detections of that. Now, I do have to show you something else. The regional trends for COVID. First off, the Northeast is listed at high, South is medium, Midwest is medium, and we do see here that the West Coast is medium. And here's the trends. You can see overall, all regions are rising. The Midwest actually came down a little bit. That's good to report. And we do see, I'm actually going to go to the chart for this. Let's go to the Northeast. We do see, remember that big rise? Yeah, it's still there, but now it's dropped back down a little bit in the Northeast. So I'm still suspect that it rose so fast, but maybe it did. I mean, there are a lot of wastewater sites. You can see here, Maine has 2 that are high. Massachusetts has 2 that are high. There's more than 2 sites in Massachusetts. They only have 2 here on wastewater scan. 1 in Connecticut, a couple in New Jersey, and 1 in Chester, PA. Take a look at this. We're seeing Bridgewater, New Jersey, has dropped again, back down to medium. That is some good news. Alrighty, I have to show you some data from CJS, and this will be the last thing we do for today. These are some numbers that he has posted. Florida, a daily number, 890 new cases. New York, 501 new cases on Monday. Puerto Rico, daily number, 914 new cases. And Texas was delayed from last Friday. This is what they reported. 2,916 new cases, 524 CDC reported hospitalizations, and 13 deaths reported by the CDC tracker. Tuesday numbers, Florida had 1,571 new cases and 1 new death. New York, 419 new cases. Puerto Rico, 996 new cases and 7 new deaths. That's a lot of cases for Puerto Rico. Maine, weekly number, 194 new cases. First time over 51 in 2 months, indicating a possible data dump. Remember, we're seeing wastewater go up there, so some of it could be part of a rise. Maryland, weekly number, 966 new cases and 4 new deaths. Virginia, weekly number was 1,959 new positive tests. And then Wednesday for Florida, another 1,528 new cases and 13 deaths. Yeah, Florida does definitely have a problem. New York, 421 new cases. Puerto Rico, 909 new cases. Oregon, 5 new state-reported deaths. Washington, 605 emergency department visits, highest weekly count of 2025, and 8 new deaths. All right, he did also include some selected 4-week COVID counts from July 4th through to August 1st. But before we read that, let's pause and take a hydration break, shall we? Water was a drink of choice today. Very important to keep yourself hydrated. All right, these again are 4-week COVID counts from July 4th through to August 1st. Arizona, 3,553 cases and 304 CDC reported hospitalizations and 13 deaths reported by the CDC data tracker. California, at least, wow, this is a lot of cases, 16,196 positive tests and 2,744 CDC reported hospitalizations and 126 state-reported deaths. Connecticut, 2,074 cases, 96 CDC reported hospitalizations, and 11 deaths reported by the CDC data tracker. All right, I hope you're sitting down for this next number, because it's a really big number. It's a really bad number. Shows how bad summer is in Florida. No, not as bad as other summers, but it's 2025. You probably thought, some of you may have clicked on this thinking, oh, COVID was a scam, it's over, it was never real. Wrong. Here's Florida, 32,767 cases, 3,530 CDC hospitalizations, and 207 state-reported deaths. Hawaii, another big number, not as bad as what I just said from Florida. 1,638 cases. Information for the first full week of July is not known, so this is missing data. 187 CDC reported hospitalizations and 11 deaths reported by the CDC data tracker. Indiana, 1,766 cases, 150 CDC reported hospitalizations, and 19 deaths. Kentucky, 1,372 positive COVID tests, 114 CDC reported hospitalizations, and 17 deaths. Maryland, 2,382 cases, 242 CDC hospitalizations, and 13 state-reported deaths. New Jersey, 2,858 cases, 488 CDC reported hospitalizations, and 21 deaths reported by the CDC data tracker. New York had 11,762 cases, 1,007 CDC reported hospitalizations, and 48 deaths reported provisionally by the CDC. Puerto Rico, this is how bad Puerto Rico has been the past 4 weeks. 15,063 cases, 787 CDC reported hospitalizations, and 62 state reported deaths, including a batch of 40 that were reported on July 19th for June and early July. Texas has had, and I need to zoom this out, my recording is actually in the way. Texas has had, hang on, got to zoom it out again, 6,900 cases and 1,763 CDC reported hospitalizations and 43 deaths reported by the CDC. Virginia, 4,535 positive COVID tests, 257 CDC hospitalizations, and 16 deaths reported by the CDC data tracker. Over the past 4 weeks, the CDC has reported 17,000 326 COVID-related hospitalizations and 702 deaths have been added by the CDC data tracker over the past 4 weeks overall in the United States. So, yes, some states have had a ton of cases this summer. Florida, that's just a god-awful number. Come on, you need to take this more serious. Alrighty, folks, that does it for today's virus update. If you enjoy it, give it a thumbs up. Subscribe if you're new down below. Hit that notification bell. Share this video with anyone you know. Of course, leave your comments down below. If you want to become a member down below and maybe get the videos earlier on the weekend and a few other things, you don't have to become a member, but if you want to, you can do that down below. You can just click on my channel. There's a membership tab. It'll show you how to do that. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Thursday afternoon. Thanks for watching. Take care.